So friends, let us bunny be out of the basket. These are all registry data, and it clearly proves the technology is winning. And whether we like it or not, with the computer navigation alone or with robotics, with burr, haptic, non-haptic, I've been through all the literature, and it clearly favors the technology will always give better result. Unlike Parrott's paper, this is which I'm going to talk about in brief. Unlike Parrott's paper, this is one thing which is going to lead the way. Of course, not with present price and present format. It will be much different. So this is procedure satisfaction in primary totally replaced by technology assistance. And you have 3 or 4 options: robotically assisted, computer navigated, IDI, which is something of a different branch of, and not technology assisted. You can clearly see that all technology assisted knees are doing better on all fronts. This is, of course, data from about 5 to 6 years. Cumulative percent revision of primary unicompartmental knee replaced since 2015 by robotic. Again, you have a winner in form of technology. Another such registry data, cause of revision comparison, cumulative incidence of revision diagnosis in primary unicompartmental, not robotically, is way down than robotically assisted. So this is absolutely unbiased, not a company data, and which proves that precision and more precision with, of course, shorter operative time is going to work out. UK registry. So we showed you the data from, this is the 4th registry which supports in terms of patient satisfaction, technology is here to stay. I'll briefly cover what I'm sure delegates already know: CAS the concept, CAS the patients, CAS in surgeons. Friends, my whatever data I could get on hand, meta-analysis, papers, everything put together, it proves one thing very strongly, that obesity, extra-articular deformity, there are some of the very typical issues that we face in our country. Technology and robotics are going to lead, and computer navigation will be an assistive. I call it sense organ, work organ combination that we were taught in our school. Sense organs give information, but in form of robotics, with burr, with saw, you're going to implement it the way it is being scheduled, the way it is being already planned. So I think this is a welcome addition. Of course, there are a lot of caveats here. There are a lot of people who do complete, like one company allows you to sit on the chair away and the robotics does the job. So there are various levels of involvement. There is a company which makes it non-haptic. So you have to be careful about soft issues. So with all this consideration, a mature decision to go technology way is going to be the winner. That's what the registry data and the meta-analysis show. So this is my humble experience, not like stalwarts here. Obesity, CAS and obesity, of course, it is a great help to find out the axis, which is very difficult with your non-technology thing. And these are all the papers in obesity where technology has been used, navigation has been used, and has a better result. Extra-articular deformity, we need not repeat it, but this is the way to go now in extra-articular deformity, coming almost near to the precision. So this is our short series of about 241 cases that I'm just going to show. Sorry. Parrott paper has put rest to all the arguments that whether precision alone can lead to good clinical outcome. At that point of time, it was truth and science, but as we stand today, registrar data now is tilting towards technology. So again, this paper, which is being dished out as something, taking a concept of perpendicular to mechanical axis, was shown to be the paper that will go against technology, but registry data is showing quite contrary. This is Ritter's very extensive analysis of 5,000 odd cases. Again, it says keep it neutral and plus or minus 2.5 degree, and this should work out well. So there are claims and counterclaims, but as we stand today, to me, the registry data from 3 registries the most powerful tool that we can use for computer navigation and justify. So these are navigation world over. Growth rate is 5% per year in Australia and Germany. It is not so popular in UK. More than 100, this is navigation data, that is in 2015. And now I'm told that we are the fastest buyer in terms of robotics. I'm told by many companies put together, almost about 40 to 45 installations are already there. So anything which is as popular as this has got to be good. So this is where I use Sai system for 6 years, and we have a data which we analyze with scanograms, and it proved that it works as good or better. So conclusion, there was some error in tibia femoral sagittal reading. Chi-square test is not significant, therefore it justifies the use of computer navigation. So friends, I come to the end of talk. Computer navigation, is it still an option? Undoubtedly opened a vista of accuracy, offers accurate bone cuts and perfect soft tissue balancing, invented in 97, and look where we are today. And it is based on principle of joint line perpendicular to the mechanical axis. In view of kinematic alignment, that might be a controversy which needs to be debated after we get enough follow-up and data and registry material. Cross-checks and checks through all stages at bony cuts, rotational alignment, coronal balance, parietal balance, and navigation versus conventional parameter. The data again favors navigation. Meta-analysis, registry data, there is a huge attempt to prove the result and accuracy to correlationship of CN, and registration lacked in execution in robotics. Yeah, Parrot paper we just spoke about. So undoubtedly with the CN alone or together with robotics has created response like fly-by-wire expectation. And synergy that is brought with AI will definitely make robotics accurate component positioning in future. And this is what the graphics, the way we started in 2001, and we are going. Friends, what is needed is the gadget has to become much lighter, much cheaper, and affordable to most of us. Because undoubtedly data, whether you take whichever way, whether you make it smaller like a iPhone or another way of presenting is digitalized spacers put in, all these put together will lead to a better result in future. Thank you.